Well, hello, everyone. Just as people are continuing to join, I think we're going to go ahead and get started. I would like to welcome you all and thank you so much for taking this time out of your busy day to join us for this very interesting conversation on food access concerns and perceptions, research led by FLEdGE. At this point in the pandemic, COVID has really touched every aspect of our lives. And what's really been quite remarkable and striking to everyone, I think, is the incredible kind of tragedy in the loss of life and human potential that has already occurred. But where this has also happened, we have especially felt the effects, I think, where there have been disparities in where COVID has affected the lives of individuals and populations. And nowhere has this been really more tangible than in the food system. And I think that this is kind of one of the drivers of the interest and impetus and kind of devotion to this topic on the food system and food security and in food policy in Canada today. And so I'm delighted that we have this opportunity to speak today and delighted to introduce my colleagues who are going to shed some light on this issue and hopefully help us to take us through this dialogue together. So today's webinar is hosted by FLEdGE, a SSHRC-funded partnership grant on sustainable food systems that's led out of the Laurier Center for Sustainable Food Systems and the UNESCO Chair on Food, Biodiversity and Sustainability Studies at Wilfrid Laurier University. At the outset of the pandemic, Kwantlen Polytechnic University, who's involved in the FLEdGE partnership network, very quickly and astutely leapt into action at the outset of the pandemic and initiated this research. And so I would like to also thank Kwantlen Polytechnic University and as well as FLEdGE for supporting this webinar here today. So how we're going to proceed today is we have a bit of a description of the project, and each of the panelists are going to speak, as well as having a discussion on some regionally specific issues and insights. We'll then move to our respondent, Marianne Martin, who's going to kick us off in reflecting on the findings from this research. And then finally, we hope to leave plenty of time for questions and answers from all of you participating today. I'll just keep a reminder, just a little bit of housekeeping before we proceed. A reminder to just keep your microphones on mute unless you're actively speaking. And if you do have questions for the panelists or for the organizers, to please use the Q&A function here inside the Zoom platform instead of the chat function. We have Amanda De Battista and Heather Reed, who are going to be closely monitoring those channels and assisting with that. And I would also like to thank them for their tireless organization of this webinar and assisting us with the platform. Okay, so without further ado, I would like to introduce us to our first speaker, who is let me pull up my other slide here. I would like to introduce us to our first speaker, Walapak Palasub, from Kwantlen Polytechnic University, to kick us off.
All right, thank you, Kathy. So I will share my screen. All is well? All right, so good morning or good afternoon, depending on where you are. I am Walapak, and I'm a research associate with the Kwantlen Polytechnic University, the Institute for Sustainable Food Systems, and I am broadcasting from Vancouver on the unceded and traditional and ancestral lands of the Musqueam, Squamish, Tsleil-Waututh peoples. While preparing for this presentation, it reminded me that my family and I were at the Toronto airport last March, getting ready for an overseas flight when the government of Canada advised against all non-essential travels. And then we thought about it, should we go, should we not go? You know, okay, we'll have to be a good citizens. We turned around, got back to Vancouver, and we thought, it will be over soon. But it is hard to believe that it's been over a year now since then, and we're still here connected through Zoom. I am grateful that I still have my job and still have my health, but we know that not everyone is as fortunate. So in our presentation today, we'll take a look at what we've learned from the survey we conducted last year during the first wave of the pandemic with respect to food access, challenges that people have, and the food system perceptions. Just a little bit of a quick introduction of the project. So the survey was conceptualized in BC, and then we brought the idea to our colleagues at FLEdGE to see if we could work together and roll out the same survey in the respective, in our colleagues' provinces as well. So we have a team of interdisciplinary researchers, and I think that that is one of the strengths of our study. We have Mary from Alberta. Her focus is on sustainable agriculture and rural development. And we have Irina from Kwantlen. She specializes in communication, culture, and health. And we have Diva, who's an expert in food environment, nutrition, and health. She's from McGill. And my background is in economics. So we got the survey set up in BC, Alberta, Ontario, and Quebec. And today we're excited to share these results with you. And even though Atlantic Canada is not included in the study, Kathy and her food policy lab team at Dow were very crucial in our questionnaire revision and development and making sure that we use the right language regarding public health communication. So these are all the collaboration that we have, and I really appreciate FLEdGE that brought us together. So before we continue with the results, I'll just give you a quick overview of what's been going on in terms of the impacts of our economy and the food system. So at the beginning of the pandemic, when many things were still uncertain, we did not know exactly how the virus could spread. Rules and regulations and all the health recommendations were very new to us all, and nobody knew exactly what to do. And you know, there's so many uncertainties and the fear of limited food access, and all these things drove some consumer into stockpiling of food and certain essential items like toilet paper or cleaning supplies. So in the graphic on the left shows monthly grocery store sale in 2019, January 2019 to December 2020. And we can see that there is a bump in March here before it adjusted down a little bit. So that's the period where it's just happened, so many uncertainty, and nobody knew exactly, you know, what's going on. So there was a bump in terms of grocery store retail trade sales. But on the contrary, receipts from restaurants and drinking places had a large drop here. So this again from January 19 to December 20. So there's a large drop here. At the very bottom is April 2020. And that's when, after the pandemic was announced, and so many, all of us said, okay, we have to have restrictions on gathering, and you know, so that's why many restaurants were closed then, and so we see a large drop in restaurant sales, and then slowly it climbed back up a little bit, but overall it's still lower than the period of the previous year. And in many places, with so many restrictions in place, many of the businesses had to reduce operation unfortunately. For some, they have to close down, leading to a massive layoff. So employment was at the record high in May. So you see that, you know, there's a movement of things are happening, you know, like March, something happened, April, something happened, and in May, again, we have the highest unemployment rate happening in May here. And slowly, as our economy reopened, people started to go back to work, unemployment rate dropped down since then, but still right now, still higher than the previous year. And at the same time, food price started to climb a little bit in the summer. So the figure on the right is show the consumer price index for select food products. The consumer price index is not the real prices of these products. They are indicators adjusted for inflation, which enable us to compare how the overall food price has increased or decreased over time. So we have the food price of meat on the top black line, and then we have the flour and the fresh fruit and products. So these are just an example. So we see that after the declaration of the pandemic, we see slowly in the summer, meat price has increased a little, quite a bit. And then right now, sitting here compared to last year, so quite a bit higher from an index of 160 to 170. And at the same time, the price of flour and fresh fruit and vegetable kind of fluctuate a little bit, and we see a large spike on the price of flour. For example, these are the time when people are stuck at home and then, let's just bake. So these are just some of the indicators that I pulled out to show you. So as we see that everything is connected in the food system. So when businesses such as food service establishments were closed or operate at reduced capacity due to the physical distancing guidelines, this directly affects local producers. Border restrictions create uncertainty for farm businesses, because they depend a lot on the migrant labor. And throughout the year, we heard more and more stories of outbreaks on farms and meat processing plants, and all these made the general public be more aware of the underlying issues in our food system, such as workers' living and working condition, healthcare coverage for them, and the right of foreign workers, and the need for all level of government to collaborate to address all this issue in our food system. So all in all, the pandemic caused worldwide recession, and food insecurity has become a prominent issue. So in our study, what we're interested in is how people adjust their behavior and what challenges they have with, and also with everything that happened in our food system. We're especially interested to see how they perceive the current global food system compared to local regional food system. So without further delay, I would like to invite Diva to present the pooled analysis for our study.
Thank you so much, Walapak, for that excellent introduction to our topic. I'm just pulling up my slides. Here we are. So I will carry on from where Walapak left off and just use this visual image to take us back in time to around this time last year, when it's probably a very familiar image of having to line up to get into a grocery store because of the physical distancing measures that were put into place to limit crowds of people coming together. So this is something that became somewhat of a new normal last year and lasted for several months, where we had to be very orderly in how we entered different types of essential retailers. So before I get into the information on the pooled analysis, I would like to ask Heather to pull up the poll. I think it's a nice way to kick off our presentation to have some audience participation. So we prepared 2 poll questions just to kind of get the thoughts flowing on this topic. So if you'd like to take a minute to answer these 2 questions, the first is, has your in-store grocery shopping schedule changed since the start of the pandemic? And the second, did you make any of the following changes to your food purchasing because of the pandemic? And that's a select all that apply. So we'll give a few moments and the results will appear on the screen after everyone has answered. I'm just waiting to see if the results will appear. We'll give it a few more minutes, or moments, I should say. There we go. Okay, so the majority of our attendees have indicated that they shop less often in store, more than half of individuals. And a good proportion has also said that this has fluctuated over the course of the pandemic. So that's something to keep in mind as well, how sort of the public health situation may have impacted our shopping habits. And the second one, this is interesting, any of the following changes. So about a third saying they buy more non-perishable items and also just more food in general. Almost half of respondents have now reported using online grocery methods, and some other interesting responses, more people growing their own food and ordering some meal kits delivered to the home. So just some thoughts to keep in mind as we give our presentations and then have our discussions again. So this was a very non-scientific poll, but I think interesting to set the stage and get the thinking going. All right, so I'll give a background to the project. This was an open online survey, so it was voluntary for adults of the age of majority or older to participate in. And it was advertised via our professional networks and also social media campaigning. It was open for responses for this particular set of data that we are presenting in the analysis between June 1st and August 31st. So that was during that first wave of the pandemic, but sort of after the most severe period of the pandemic had somewhat passed, which was more in the spring preceding this time period. There were some questions related to consent and eligibility screening, and then a number of content questions, mostly closed-ended, multiple choice or scale type questions. But we also had some open-ended questions with free text responses that my colleague Irina will get into in the next section. The major themes that we evaluated were related to food purchasing patterns and perceptions about food access and food systems. There were also some questions on potential diet changes or shopping habit changes. And we had a number of items that we used to characterize some sociodemographic groups of interest, and that's really what my focus will be on today. So the objective of the pooled analysis, where we combine data from the individual provincial responses, was to examine self-reported changes to food purchasing patterns and perceptions of food access before and during the first wave of the pandemic. The hypothesis was that more vulnerable sociodemographic groups, including lower income groups, equity-seeking groups, and those who experienced negative employment impacts as a result of the pandemic, would report more difficulty and more concern over food access compared to less vulnerable groups. And there was also an exploratory aim, given the uniqueness of this situation, which was to examine the responses of individuals who indicated that they belonged to a group that was at higher risk of severe illness from COVID-19, and to really carefully look at their food-related experiences, because these were the groups of individuals who were instructed to shelter in place because of their higher risk of having severe illness. And this is a map of where our respondents came from. So we captured four provinces from across Canada. These are the most populated provinces, but certainly not all of Canada. But this is who we were targeting in this particular collaboration. In total, there were about 2,600 respondents who gave consent to participate in the survey, and about 2,500 of those responded to the final survey question. So it suggests a completion rate that's quite high, about 96%, but it is important to note that this is a voluntary survey. Every item was optional to respond to. So as a result, the individual sample sizes for each survey item vary somewhat. Now, the sociodemographic groups of interest, I'll describe those. There were 5 of them for this particular analysis. The first was the subset of respondents who identified as being part of a group that was at high risk of severe illness as a result of COVID-19. And that was about half of our respondents. And you can see the criteria that were possible selections to indicate being part of a high risk group listed below. Also, we were interested in participants who identified as belonging to an equity-seeking group, and this was about 33% of our respondents. So those could be Indigenous peoples, persons with disabilities, racially visible persons, women in roles in which they are underrepresented, and there was also an option to specify with a free text response. We also evaluated respondents who reported that they were residing with children under the age of majority in their household. That was 28% of our sample. We look closely at annual household income as a sociodemographic group of interest. And so you can see the distribution there. About 10% of our respondents had very low incomes of under $20,000 per year. 31% earned between $20,000 and $49,000. 27% earned between $50,000 and just under $100,000 per year, and about a third earned $100,000 or more. So we did have a subset that was quite high income earning group. And lastly, we characterized a group that had a negative employment impact as a result of the pandemic. So that was defined as those who reported losing their job or having a reduction in their working hours because of the pandemic. So indicative of some kind of income loss. And so that was about a quarter of our sample. A very small proportion responded that they had to retire or chose to retire because of the pandemic. That was 2%. And then 3/4 said they had no change to their employment status, or they actually increased their working hours. And we grouped them together because it suggested that there wouldn't have been a loss of income in that particular scenario. So there are several graphs on this slide. These are the demographics of the respondents. I'll just do a very high level summary. The first bar provides the demographic for the full sample that was pooled together, and then there's individual bars comparing the provinces. So just to give a quick summary, there were some individual differences in demographics across the provinces, and we'll get into those a little bit more when we talk about the regional reflections at the end. But what you can see in the total sample is we had a pretty good distribution across ages. So from younger participants aged around 19 to 30, all the way up to those who are more older age, 70 or older. It's relatively equal spacing across the decades in our respondents. In terms of gender, overwhelmingly, our respondents were female. In terms of education, they were educated, most people having a bachelor's degree or higher. Most respondents were married, but there were also about 20% who were reportedly being single or never had been married. And there were some differences across the provinces in those demographics. When we look at employment status, about half of the participants were either full-time employed or part-time employed, but we also had a significant group that was reportedly retired, about 15% of the respondents, and about 20% were unemployed. When we look at income, I had described that in the previous slide. So we had about a third of the participants being relatively high income earners of over $100,000 per year or more, and about 15% who were lower income earners under $20,000 per year. Household size was fairly mixed. We had close to 20% of respondents being from single individual households. The majority were living as a pair or a couple, but then we also had a good proportion, about 40%, who had 3 individuals or more, so perhaps reflective of more of a family type of household structure. And when we look at the regional classification as urban or rural, the majority of the respondents resided in urban regions, but there was some variation across the provinces there. So we looked at comparison of food access methods before and during the pandemic. So we had one question framed for the year 2019 prior to the pandemic. We asked the respondents how they accessed their food. And then since the declaration of the pandemic, we repeated the question. Now this bar graph shows the comparison of both time points. So in orange, it's the access method since the declaration of the pandemic, and in blue, it's food access methods prior to the pandemic. So some interesting observations of changes. I think the most striking is the large increase in participants who reported using online methods of grocery. And that corresponded with a reduction of the proportion indicating that they shopped in person for their groceries. Also quite a large reduction in those indicating that they shopped at farmers markets. And as can be expected, a very large reduction in those reporting not only dining in at restaurants, but also taking out from restaurants. And somewhat interesting to observe is that there was a slight increase in the proportion who reported growing or farming their own food since the start of the pandemic.
We asked the participants about what factors might be limiting their access to food at the time that they responded to the survey. Most participants, or about half, said that their access to food was not limited. So you can view that as a positive, but also being mindful of who we were able to reach in the survey. We have that a little later on as a discussion point, but this is not a group of vulnerable participants, but in the general public that comprised of more higher socioeconomic status individuals. These, for the most part, are respondents who did not report access limitations to food. But there were some interesting responses when participants reported they did have some limitations, and most notably the response from about a quarter of the respondents that they were too worried or anxious to go out and purchase food. We also had 20% said that their income was limited or that food was too expensive. And really reflective of the times is the reality of the need to quarantine or self-isolate in certain situations. We had almost 10% of our respondents who reported that that was an issue limiting their access to food as well. We looked at the frequency of grocery shopping. Now, these questions were only framed at the time that they participated, so since the declaration of the pandemic. And so the most common reported shopping frequency was 4 times per month, about once a week. But it's interesting to note that in 2019, the estimated Canadian average frequency for grocery shopping was actually a little more than once a week, so closer to about 1 to 2 times per week. So perhaps there has been a reduction in the frequency in this sample of respondents in our survey. We also asked them how often they purchase food using these online methods or the no contact methods. Many participants said they did not use those methods, about 40%. But for those who did, the most common frequency was about 2 times per month. There's some who look like maybe they gave it a try once or twice, and so they used it fairly infrequently, but tested it out. And there is a small subset of participants who do seem to be using these methods quite regularly. We also asked the participants how difficult it is to currently access food. And again, potentially you could view this as a positive overall, that most participants gave a very low ranking of the difficulty. The average score was about 2.8 out of a 10-point scale. But we decided to look at this with that consideration of potentially vulnerable subgroups and how they would have answered this question compared to those who wouldn't be categorized as a vulnerable subgroup. So we categorized this 10-point scale into 3 groupings: those who ranked their difficulty as being low, medium, or high. And then we performed a logistic regression analysis looking at the odds of ranking high versus low difficulty, adjusting for a number of sociodemographic variables. And so when we looked at those potentially more vulnerable sociodemographic subgroups, we saw a different pattern of how they answered those questions. So if you look at the subgroup of income, the groups that had the 2 lowest income categories, so less than $20,000 per year or $20,000 to $50,000 per year, they had a significantly higher likelihood of reporting a high level of difficulty accessing food versus the reference who earned the highest income category. And when you look at the participants who reported being at a higher risk of severe illness, there was also a higher risk of severe illness from COVID-19. There was also a significantly higher odds that they reported a high level of difficulty accessing food compared to those who didn't identify as being at higher risk. When you look at the equity-seeking group, there was also a significantly higher odds that they indicated a higher level of difficulty accessing food compared to those who did not identify as part of an equity-seeking group. And for the last 2 groups that we evaluated, having children residing at home who are under the age of majority, and those who had an employment impact, there were no significant differences in the odds of reporting high or low for those 2 groups. Now, these were adjusted for a number of sociodemographic factors, including age, gender, education, the province that they resided in, their household size, whether they lived in an urban or rural region, and income when it wasn't the primary predictor variable. We also had a number of questions about level of concern about food access, and these were framed over different time periods. So really the root statement here was, I didn't have access to enough food for active, healthy life for all household members. And this was framed over the year prior to the pandemic in 2019. at the time of their survey participation, so in that month when they responded to the survey, and then thinking about future access, thinking about the next month, how their level of concern for those 3 time points. And the options that participants had to respond to these 3 items were never true, occasionally true, usually true, or always true. And we did these subgroup comparisons again with these items, and we collapsed the 4 options into 2. So those who said that these statements were never true or occasionally true were grouped as having a low level of concern about food access. And if they said this was usually true or always true, they were defined as having concern about their food access. And we performed a similar logistic regression style analysis. So this graph shows the results for the income groups. So this is across those 3 time points that we surveyed about. And what you can see is that for all 3 time points, the groups that had the 2 lowest income categories, so 20,000 to 50,000 per year or under 20,000 per year, they had a significantly higher odds of reporting concern about their food access at all 3 time points compared to the reference, which was the group that earned the highest income. And when we looked at the subgroup difference by employment impact, there were no differences when the question was framed for the year prior to the pandemic and also at the time of their survey participation. But thinking about the future food access, about next month, those who became unemployed or had a reduction in their work hours had a significantly higher odds of reporting concern about their future food access compared to those who had either no employment impact or they increased their working hours. So that was the only significant difference that was observed, was for future food access amongst those with a negative employment impact. The dark blue bar here, this is the group that chose to or had to retire. It was a very small sample size. So although it looks similar to the lighter blue bar, it's very small and was not a significant observation. And for the final remaining groups, for those who identified being part of an equity-seeking group or at higher risk of severe illness from COVID-19 or having children at home, we did observe that there were higher levels of concern, significantly higher levels of concern amongst those who reported belonging to a group at higher risk of severe illness and those reported belonging to an equity-seeking group. And this was again similar to our income observation across all the 3 time points that were defined. But there were no significant differences in how food concerns were reported, whether participants had children at home or not. Now, we looked at some reported changes to food purchasing habits since the start of the pandemic, but we asked this in 2 ways. We asked the respondents what types of food they buy more of, which is the top graph, and what types of food they buy less of. So they had an opportunity to kind of tell us in 2 ways about their purchasing habits. What I think is really interesting is the responses to what types of foods they're saying they bought more of. So many participants, about 40%, said they were buying more baking supplies, more dried and canned foods, and also about 1/3 saying they were buying more frozen foods. So this really tracks with that observation that Walopak pointed out about sort of increased purchase of non-perishable type items and flour in particular, and baking happening at home potentially more often at the beginning of the pandemic. So I think it's interesting to observe some consistency in our results with what's been reported elsewhere. And it also just seems that participants were buying more food in general, or at least telling us that they were. And if you think of our own audience poll, that was a response that we saw as well to the poll that was asked at the start of the webinar. I also think it's interesting that it's not a very large subset, but 13% of respondents indicated that they purchased more dietary supplements. Now, I don't think that's because people were concerned about becoming sort of deficient in their micronutrients because of the lockdowns, but I think it might reflect some perceptions that these supplements could have some benefit to the immune system and potentially offer some protection against infection. So it's interesting to see that as a response as well. Now, in terms of foods that they bought less of, most participants said there was no change to that, but it's kind of mixed. And I think the fact that this is mixed really reflects that people's individual changes would be quite variable depending on personal preferences and personal circumstances. So it's difficult to interpret both of these together, but people were saying they were purchasing less sweets and salty snacks and less fresh food, less meats and prepared meats, but it's not a very large proportion who indicated that. I think the more interesting observations are around what they were telling us that they purchased more of. We asked participants if their diet has changed since the start of the COVID-19 pandemic. About half of them said yes. Now, I am a nutritional scientist, so you have to look at this with a critical eye. Diet is very complex and it's quite dynamic, and people change their food habits to different degrees for different reasons. But if you look sort of overall, it seems that participants were telling us some kind of mixed changes, that they were eating more fruits and vegetables, but also more sweets and salty snacks. So something that could be sort of a positive change for health and something that maybe is less positive. But I think this mixed response actually reflects what other studies have reported since the pandemic started, that for some groups of the population, there seems to be an interest in wellness and taking the ability to be at home more and cook your own meals to get a little healthier in terms of food consumption. But then there's also considerations of stress and anxiety, and it could go either way really. And so you could have positive changes and negative changes depending on different contexts and circumstances. So I think that's what our results are sort of reflecting here. And some participants also said they began eating less meat protein. We also had some questions about perceptions of food systems. So one was about how concerned are you about the reliability of the global food supply chain? The mean response to this was close to 6, so some level of concern, and some participants were not extremely concerned. So it's a bit variable, the response to this question. So it seems like some are quite concerned about the global food supply while others are less so. But we also asked if you believe that a substantially developed local or regional level food system can be more reliable in bringing food to your table than the global food supply chain. And to this, the response was overwhelmingly in agreement, close to an average of 8 out of the 10-point scale was the mean response. So a high degree of agreement with this statement. And similarly, there was a question of, does the pandemic have you thinking that greater effort by the provincial government should be put forth to build and strengthen local regional food systems in your province or region? And similarly, as the previous observation, a very high level of agreement with that. And for these two questions, it was very similar across the provinces. There was high support for strengthening local and regional food systems. So to wrap up, I'll give just a quick summary of what I've presented in terms of our pooled results. So in general, I think the most striking observations were decreases in the reported frequency of in-person grocery shopping and restaurant dining, and a noticeable increase in the use of online grocery methods. And I think in terms of grocery shopping, what we're observing kind of reflects that phenomenon of more shopping anxiety that might have been present at the start of the pandemic, and potentially is still present in waves depending on the severity of the situation. Among the full sample, while we observed that there were low reports of difficulty accessing food, this did change, the picture changed when we looked at subgroup differences according to sociodemographic status. So participants who were belonging to a lower income group or identified as being part of an equity seeking group, as well as those who reported being at a higher risk of severe illness due to COVID-19, had higher levels of concerns about their food access than individuals who didn't belong or didn't identify with these groups. And those who had a negative employment impact because of the pandemic seemed to have concern about their future food access. We evaluated some of the self-reported changes to food purchasing and diet. So it did appear that there was some reported increase in purchasing more non-perishable food items and some mixed changes to diet that could be positive or negative. There was mixed concern over the reliability of the global food supply chain, but overwhelmingly quite strong support for the development of strong local food systems. So that's everything from me from the pooled provincial. I have a slide here of strengths and limitations, and maybe I'll save that for the discussion just to make sure we've got some time to get through the other presentations. So Irina, I'll turn it over to you for the free text results, and we can save this slide for the discussion.
Thank you so much, Daiva. Both Wallafak and you are pretty hard acts to follow. So I'm just going to share my screen here. Oh, you're still sharing, Diva. Perfect, thank you. So hello, everybody. I'm Irina Knazovic. I have been working on the Ontario part of this survey with a fellow researcher and a colleague, graduate student here in the Communication and Media Studies program at Carleton University. And we looked at the text responses to that set of questions that Diva discussed sort of towards the end of her presentation, which were the questions around global and local food systems and people's levels of confidence in each one of those. And so what we looked at, and you'll see in a minute the number of responses that was sort of one of the findings that stood out for us. It wasn't necessarily surprising, but we're quite, we noticed that the level of support for local food systems really stood out. And so what we wanted to do is better understand the reasons that people provided for that, because we know there are activists and practitioners and scholars, but also policymakers who would like to see better developed local food systems. And it sounds like this might be the political climate to do more on that. And so we wanted to better understand what the reasons were for people's levels of confidence or concern for sort of these categories of food systems. And so we did a qualitative analysis of these text responses in vivo. We're still working on it, so these are just sort of preliminary results, but we found already that there was an abundance of insights. We sort of reached saturation pretty quickly. I think a lot of the answers started repeating themselves relatively quickly in the data set, but we have a pretty significant data set here. One of the things we found is that in the reasons that people were providing for their numerical responses, there wasn't really any major regional differences in the findings. So a lot of the reasons were kind of similar. And we also found that the numerical response, which is the response to the question of, are you concerned with the reliability of global food supply? The actual number that people would provide to indicate their level of concern wasn't necessarily strongly associated with the kind of text response they would provide to accompany that question. In other words, even people who expressed low level of concern with the reliability of global food system often provided very similar reasons for why they would be concerned at all. And that will all become a little clearer, I think, in a second here as I go through the next slide. So the first question that we looked at is this question about how concerned are you about the reliability of the global food supply chain? And they could indicate their numerical answer from 0 to 10 and then explain why they answered in this manner. So the main themes that we identified in this question are listed here. And what I'm going to do next is actually provide you with just some illustrative quotes to kind of give you a sense of what people were really concerned about. So the first thing that I want to point out is that the answers were actually, some of them were simple. Some would just say, you know, I'm worried that global food system is not reliable, for instance. But most of the answers were actually really well thought out and would often provide more than one reason. They were also quite often justified. So in this particular quote, somebody describes that they actually work in trucking and understand the supply chain and transportation between Canada and the US. So their answer is basically based on that understanding. We also found that people really often provided complex and comprehensive responses to this question, so that their understanding and consideration of the global food system was actually quite sophisticated. It wasn't a one-off sort of response. And so the biggest sort of group of answers we had to do with supply chain disruptions, which shouldn't be surprising. But a lot of people expressed concerns around shortages in grocery stores, and some of those were based on what they witnessed in the stores in their neighborhoods. But then in some cases, people maybe didn't really experience those shortages in stores, but were really worried that they were quite possible and in fact, probably quite likely. Concerns around transportation, particularly related to border closures, but also things like truckers potentially getting sick with their common travel, and other things seem to really come to the forefront with this particular concern. Labor was another category where a lot of people seem to be concerned with labor in terms of food processing plants, as well as farm workers. And in a lot of those cases, people were, some people were just concerned that that would interrupt the supply chain. but a lot of people seem to really express concern for the safety of workers and the conditions under which they would be working. In some cases, people also expressed a great deal of distrust in the global food system, and some of that was well rationalized. In other cases, it seemed to be just a vague kind of fear of food that comes from elsewhere. But labor was clearly one of the concerns that they had. In particular, when I say labor, things that workers might not be protected well enough and therefore would not be able to keep our food safe, and that would result in recalls and supply chain interruptions. Local food also appeared quite a bit as one of the answers, and that sort of fell roughly into two categories. So people who are already trying to rely on local food mostly, so the interruptions to the global food supply system was really not something that they were terribly worried about because they were already relying on local. But other people talked about the need for more local food, which will be something that I will revisit in the second part of my presentation. Quite a bit of concern around geopolitics, particularly in terms of the relationships between Canada and the US and Canada and China, as well as concerns around exports, imports, border closures, and things like that that would be more political than public health measures. So there are quite a few answers that were concerned with geopolitics. Affordability really came up to the surface. So people noticing that food prices were going up, but also a great deal of concern expressed by people who would say that they didn't necessarily experience difficulties accessing food and were not worried about the prices, but were really concerned for others who might not be able to afford healthy, nutritious food regularly. And another category of answers that we see here is that of adaptation. So that people were indicating that they noticed some shortages. They were worried that certain things globally wouldn't make it to the grocery shelves, but that nevertheless, they figured out a way to adapt and just buy whatever was available. Resilience of the global food system and sustainability was also quite prominent in these answers. The people did not necessarily trust that global food system or global food supply chain was designed to be resilient and sustainable. And a lot of those answers were quite sophisticated and complex as well. But some of the participants also indicated that what they've seen is that the system actually has proved itself resilient. So this one participant said, if anything, it has persevered. And a number of people also indicated that they had no concern, and some of those were based on just personal experiences, so people who didn't see any shortages so far, but also people who work in the industry and felt that the global food supply chain was quite reliable. So there were some of those answers. So then the following question we asked, well, during the pandemic, do you believe that substantially developed local regional level food system can be more reliable in bringing food to your table than the global food supply chain? And in those answers, and you'll notice, I apologize, I should have pointed that out earlier, but you'll notice that the numbers of answers we received for these two questions are quite a bit higher than the data that Diva presented. And that is because we included two related data sets in this particular analysis. In the interest of time, I'm not going to explain why we thought that was a good decision, but if anybody wants to know more about the sort of methodological rigor decisions that went around whether to include those data sets, I'm happy to answer that offline, so get in touch with me at any point. We do have a good explanation, but I'm not going to get into that in the interest of time. So with this particular question, what we found was that people responded again in pretty complex ways. So many people pointed out to the multiple benefits of local and regional food systems. They spoke about food security and self-reliance, economy, environment, trust, seasonality, labor, and then there was this kind of category of it's just the right thing to do. So with multiple benefits, you will see that many people talked about sort of economic, environmental, social, and health benefits, and the kinds of things that we can actually really think about to have a healthier population, that we have fewer chemicals sprayed on different foods, etc. So I think there was quite a bit of complex thinking there. Food security and self-reliance were really prominent. Some people even used terms like food sovereignty, that we really found that local and regional food systems were crucial to these. And again, these were quite complex answers. So again, I know there's a lot of quotes there to read. So if anybody wants to have a look at them after our webinar, I'm happy to share these slides as well. Economy, that was sort of, it seemed to be a no-brainer for a lot of people. They just seem that that's how you support local economy, and that's what we need to do right now. A lot of really thoughtful insights around the environment and why local and regional food systems might be better for the environment than the global food supply chain. A lot of questions around trust, particularly in relation to imported food and why local food systems as a shorter supply chain would be something that they would have more trust and confidence in. Seasonality actually came up as one of the concerns around reliability of local food systems, and that is that many regions in Canada are not able to produce fresh food year round. And that combined with perhaps lack of processing capacity across the country would be a really significant concern if we wanted to solely rely on local food systems. Labor again came up, and I think that people were really kind of thinking through how local food systems could provide local employment, but also expressing some concerns how that could happen within a global economic system. And then a number of people just had answers that were really kind of pointing to local food as just being the right thing to do. So, you know, a simple answer was just, for example, I try to eat local as much as possible. So it's not exactly a rationale, but it's just something that indicates that many people just feel this is the right thing to do, and they're not even really questioning why supporting local food systems would be important. So in summary, the key insights from this are that in general, participants raised concerns with the global food supply chain and expressed concern for local and regional food systems. Although some of them had reservations about seasonality and availability, some people also had questions about affordability of local food, especially for low-income eaters, and some of the labor concerns about availability of labor for the food sector, agri-food sector in Canada. For some participants, a stronger local food system was just common sense, but most often they offered informed and complex answers. And our findings really shouldn't be surprising to most of our attendees because they support existing literature on consumer perceptions of local food systems, but seem to be showing us a little more nuance in those supports. So I'm going to stop there. We're going to come back to the regional reports next to just kind of hear a few regional insights. I just want to, before I end, I want to just point out that my colleague Blue Dong, who's been working with this on me, is also on the line. So if she does pop anything up in the Q&A or the chat box, correcting me or adding information, just so you know it's not a Rowdy attendee, I have actually asked her to contribute if there's at any point a need to do that. So without further ado, I'm going to stop sharing my screen now, and I'm going to hand it back over to Wallapak to kick us off with the regional reports.
All right. Okay, sorry, just a second. Share screen back. Oops. After a year, I still don't get it right. All right, so we're gonna go from west to east, starting from BC. We'll just go, just give you all a quick overview for each provincial report, specific things that we find from our reports. So in BC, in case you might not have followed the news in BC, so this graph show the number of daily new cases in BC from the starting of the pandemic until the end of January. And so when the pandemic first started, all of our non-essential businesses had to close, and we entered into our phase 1 of the BC Restart Plan. And then at the end of the spring, our infection rate was down. You can see that, the infection rate started to go down right here. And so we enter phase 2 of our restart plan. Many of the businesses already put in place, the physical distancing rule, and people started to know a little bit more what to do. And so we eased the restriction. And so many businesses returned into operation, and our school reopened as well. And then we see that our cases are pretty low throughout. And then by the summer, we thought, okay, let's open up a little bit more and enter into phase 3 of our restart plan. The schools still remain open. But unfortunately, that was by the end of the summer, starting of the fall, that was the end of our first wave. And then unfortunately, our second wave started around October. And now we see, you know, I think it's everywhere. It's not just in BC, the spike in number of cases, but hopefully as our vaccination rate is starting to go up, hopefully we can see the light at the end of the tunnel. But all in all, in BC, we have done pretty well during the first wave of the pandemic. And for BC results, this is, we started the survey quite quick. So we actually put the survey out in April, right? You know, after things that's been going on, we thought this issue is really important. We really like to have it done and try to galvanize all these emotions that people are having. And so we wrote out our survey actually first in April, but then as we connected with our colleagues from FLEdGE, we thought, okay, now that we expand the survey into other regions, we have to have the survey with the same questions. So we had to adjust our survey because, you know, this is just sometimes when you wanted to do things quickly, it might be a little bit, you know, something we might not get it right. So for the first period of our survey, there were a couple of questions that we thought we didn't get it right, but then all our colleagues came together and improved the survey. And so then we rolled out the survey again at the same time of other colleagues. And so that's why we have two time period. The first time period, we did not use advertisement in terms of paid advertisement at all. It was just all through our networks and through the free social media channel, and we got really high response. And I feel that that was because, you know, people were at home and they're really seeking something, and, you know, the survey opportunity comes up, and then, okay, let's respond to this because it's really an important issue. And then by the time summer rolled around in BC, things were good at that time. And when we revise the survey, then we have a little bit more response, but not as much as during the first time frame period. But because of this though, because we have the survey open in quite a long time at the first phase of the pandemic, when things were kind of quote unquote lockdown, and then later on when it opened, we were able to kind of compare a little bit how people react or behave during this time frame. So the thing that we found, it might be trivial, but we found interesting is that seasonality or the weather do affect people behavior. For example, especially during the pandemic, right? For example, you know, the rate that people go out to restaurant dining increase in the summer. And at that time, you know, regulation was that it's okay now for you to go out and you keep distance and sitting outside to eat. So these are a couple of examples. And also online shopping or grocery store shopping, it doesn't matter which time of year, it's still the same rate that the weather or seasonality that doesn't impact. And it's similar to what Irina found, that the seasonality does impact the ability for locally for us to produce food. Okay, so I'm just going to wrap up this by giving you a little bit of what people say in terms of the support that they want to get the amount of food that they want and at the time that they want. And interestingly, we found that people actually specifically say that they would like to have more access to locally grown products. And it's just that they specifically said it's not just any food, it has to be locally grown products as well. And that resonates with what Irina found, that, you know, some people think that's the right thing to do, and some people understand that it's the driver of the economy, and at the time of crisis, Canadians have to help Canadians, so they understand that part. And otherwise, people just say in general, they would just like better shopping logistic. You know, some people are really tired of long lineup, or some people think that with the online ordering is really hard for some people, or in terms of some people say, you know, it's really hard for me to go to grocery store when I have dependents because I can't leave them at home or I can't bring them, you know, so these are just shopping with logistic in general. And next is more of the financial support, which is also similar to what Diva had found, that, you know, people who are vulnerable, financially vulnerable, they have more difficult time accessing food. So many of our respondents say that, you know, financial support would be really helpful. And finally, also people say that, you know, they would like to be able to grow or harvest or make food themselves. And this point to the issue of food education, because it's not just about having money to buy food, but it's about the knowledge as well, that, you know, if you go to the store, you want something, but it's not available, or what are you going to do? Can you substitute something else, but still remain healthy? So these are kind of like issue of the food education. And also some people said they would love to grow more own food, but they don't have access to land, you know, and then they thought about maybe gardening, community garden or anything like that would help. And many people say that they really want to have the ability to grow their own food, but it's just too expensive, hard to find seeds, for example. And then I think I will pass over to Mary to talk about the results from Alberta.
Thanks, Wolopak. Okay. Oops, sorry. I need to do this first. I'm not able to see when I go share screen, I'm not able to see my document, my PowerPoint, even though I saw it earlier. So maybe,
Mary, maybe you can start talking, Irina, here, and I'll pop up your slide in a second.
Okay, thanks. Well, I'll just start with a bit of context of what was happening with COVID in Alberta during this time. So on March 17th, the province declared a public health state of emergency. So we went into lockdown. And while major food retailers remained open with limited capacity, all other food and beverage businesses were closed, although takeout was permitted. Then on May 14th, thanks, Irina. Stage 1 of the relaunch strategy was activated, which allowed all farmers markets, cafes, restaurants, and bars to open at 50% capacity. And then shortly after the start of our survey on June 1st, Alberta proceeded to stage 2 of the relaunch, and that lifted all restrictions on the number of people at farmers markets, restaurants, cafes, etc. Next slide, please. So Alberta gained notoriety during the pandemic due to major outbreaks in March and April at 2 meat processing facilities, Cargill in High River and JGS in Brooks, which make up 70% of Canada's beef processing capacity. The Cargill outbreak, which resulted in more than 1,500 COVID cases and 3 deaths, is the largest single site outbreak in Canada, and at the time was the largest single site outbreak in North America. Frigid temperatures, cramped living and working conditions, long hours, and limited access to PPE initially put most of the mostly foreign workers at high risk. And similar to other regions in Canada, we saw impacts in other agricultural sectors during the pandemic and the resulting fracture in the food supply chain. Next slide, please. So Alberta's population is currently at 4.4 million, so we're the lowest of the 4 provinces presented here today. And it's the fastest growing and youngest population in the country. The 37.5 is the median age. 81% live in urban areas, mainly concentrated in Calgary and Edmonton, and Alberta also has the highest average provincial income. Of the 298 participants in this survey, the majority resided in urban areas, as you can see, particularly Edmonton, but similar to Quebec, we had significant representation from rural areas compared to the other provinces. Overall, Alberta respondents were predominantly mid to high income earning and post-secondary educated individuals. However, half of all the participants were between 18 and 39 years of age, which reflects Alberta's young population and may also be linked to the relatively high proportion of respondents that reported earning the lowest income category, having employment impacted during the pandemic, and holding the lowest education level in comparison to other provinces. And this may also be connected to the relatively fewer number of participants in Alberta identifying as being at risk of severe illness from COVID. There was mid to high level of concern about the reliability of the globalized food system. And one of the prominent concerns was regarding the safety and quality of imported food due to the level of handling during processing and transportation. And another prominent concern was the vulnerability associated with dependence on international labor and trade. There was a high level of agreement that a sustainably developed local and regionalized food system can be more reliable than a globalized food system, as it's less subjected to fluctuations in the global market that are caused by trade barriers, tariffs, global price fluctuations, and trade wars. And it's also noted that it would contribute to the local economy, increase employment opportunities, and help to reconnect and build trust between producers and consumers. When asked what supports were needed to access the quantity and types of foods they wanted, there were 5 main points. First, these weren't in order necessarily, but expand the diversity, amount, accessibility, and affordability of healthy and local food. Increase government support for local producers and supply chain development, increase financial support for seniors, low income, and the unemployed, increase access to information and training on food production and preparation, and increase access to land and community gardens, increase the number of community gardens. So that's it from the Alberta Regional Report, and now I'll hand it over to Irina to talk about what happened in Ontario.
Thank you, Mary. So I'm just going to pop up our slide from Ontario, and that is really just to kind of give you an overview of what we found in Ontario. But interestingly enough, so this is an infographic that Blue Dong developed to summarize. It's sort of a visual executive summary of our report. In our regional report, we didn't really see anything that stood out terribly from the findings that you already heard, perhaps because also Ontario and BC results dominated this data set. So just want to take a minute to reflect on something that's sort of a more methodological point of this for anybody who's more interested in doing this kind of work. And that is that when we first launched the survey in Ontario at the end of May, we ran it for about 6 weeks and received about 200 responses. And at that point, we caved and decided to do Facebook ads, which bumped up within a couple of weeks, bumped up our participation from just over 200 participants in a province of nearly 15 million people to over 1,400 responses. And it was very generative for us. It gave us an abundance of data, but it was also a bit of a conflicting decision that we made because we are located in Communication Studies Department, and we are very aware of all of the concerns that come around doing research that involves social media ads, particularly in terms of what that means of the kinds of platforms we're financially supporting by purchasing those ads. Garnering over 1,200 responses for the advertising that cost us a total of $400 seemed like really good value for our money. But we still felt quite a bit of tension even making that decision because we're supporting platforms that we have a lot of questions about as critical communications and media scholars. And that was a bit of a tension for us. So just something to flag for researchers who might be interested in doing this kind of survey work at a larger scale, difficulty of attracting participants, and balancing that with the desire to, do things ethically and morally right can sometimes be a bit of an internal conflict. So I'll stop there and hand it back to Diva. Of course, if you have any questions about the specific regional Ontario report, I'm happy to discuss that further.
Thanks so much, Irina. All right, so I will round us off with just a bit of a discussion of what happened in Quebec. I won't go through all the timeline points, but we were the first, well, I'd say the hardest hit province during the first wave. And similar to the other provinces, I think Canada had a very similar approach to when the lockdown occurred, but when those restrictions started to ease really varied depending on the situation in provinces and regions. But I think a couple of things to note about Quebec that were interesting is we closed all of our non-essential businesses around March 24th, and restaurants had to serve only takeout starting March 22nd. And then the week after, on March 31st, it was announced that Sundays would become a day of rest for all the essential businesses because those essential workers were really getting worn down with the constant demand of people going to stores and pharmacies. So Sundays were grocery stores and pharmacies, and also the liquor store were closed every Sunday until towards the end of May. And then our deconfinement happened over a longer period of time and over 6 phases because of the complexity of the situation in our province. But towards the end of June, restaurant dining room services were reopened as long as proper distancing and sanitary measures were in place. And that remained in place until the end of the summer. And then unfortunately in the fall, we entered into our second wave and went back into a lot of closures and restrictions and instituted a curfew that we still have in place now. So the main findings from Quebec, we did have a small sample of respondents, only 350. So echoing what Irina mentioned about the difficulty of getting people to participate in these surveys. And we did also use the social media advertising. So it was surprising that our response rate was low. But when you really think about it, this province had been really studied a lot in terms of what was going on. And there were a lot of online surveys, and really reaching people online was the most feasible way to conduct research, or one of the most feasible ways during really the thick of the pandemic and the most severe points. So I think the residents of this province had really been inundated with a lot of requests to participate in different studies and different surveys. So perhaps they were just less interested at the time that this survey was launched. It's also interesting to note we had the most male respondents in a sample that was really overwhelmingly female. We still had mostly female, but out of all provinces, we had the most male respondents, and also the most who resided in single individual households. And what was really quite striking is to observe that we had a reported 3-fold increase in the use of online grocery methods compared to use in 2019. So perhaps reflecting the severity of the pandemic in this province at the time. And we were the province that had the most mixed perceptions about the reliability of the global food supply chain, whereas the other provinces all seemed to report a higher level of concern about that reliability. The Quebec respondents were a little bit more mixed. Some were less concerned, some were more concerned, but it's important to note that because this isn't a representative sample of the province or the collection of provinces that we studied, that really this just reflects the people who answered our survey. And so I think that's going to be a key message during our discussion point, which I will segue into. But I would just like to take a moment to acknowledge the people involved for this work. It really was a team effort and collaborative effort, and people have really worked very hard over the past year. So thank you to all the study investigators and my colleagues on the webinar. Thank you so much to all the trainees who were involved and did a lot of the heavy lifting when it comes to the number crunching and organizing the data. And of course, our real deep gratitude to the funders of this work. And thank you to FLEdGE for hosting our webinar today. So that's everything from me. I had one more poll scheduled, so maybe Heather, you can pull that up, but I think I'll stop sharing my screen anyway while the poll is up, and I think we can just go right into our discussion section. So take a moment to answer the poll. If you have made changes to your food access methods, do you believe these will be long-lasting changes?
So we'll invite Mary and Martin, I think. Next, Kathy, I'll hand it over to you.
Oh, I was just going to do that. We're Marianne, you have the floor.
Okay. So I'm a postdoctoral fellow at Trent University in the School of the Environment, working closely with Michael Claessens, and we've been studying food access and food practices in light of COVID over the last almost year or so. I wanted to congratulate the team on an incredible study. I think you've really done some important work in capturing a picture of food access and concerns and practices and perceptions at a really pivotal time in Canada's history. The study has a real breadth of data geographically and demographically. And you know, with high numbers as well, with over 2,500 surveys completed. And I think it can say a lot, not only about how people respond in a crisis like this, but I think it can also provide really valuable insights into pre-existing strengths and cracks and vulnerabilities in our food systems. The findings, I know that you had hypothesized that already vulnerable populations would experience more difficulty and more concerns regarding food access than less vulnerable populations. And indeed, that seems to be what you found. Food access didn't seem to be particularly difficult for most respondents, but was much harder for equity-seeking groups, low-income groups, and people at risk of illness. And these difficulties, many of these difficulties were rooted in worries around going out and around income and affordability. Much of this has resonated with the work that we have done. We also found struggles around vulnerable populations. We found online food shopping went way up. Farmers market usage went way down. We found more people interested in growing their own food. We also found a sort of a split or a diversion between people eating more unhealthy food and people eating more healthy food. So you found more sweet and salty snacks. We found people eating more industrial, processed and prepackaged foods and getting them at more industrial sites or big box stores. But the same with fruits and vegetables. We definitely found people eating more fruits and vegetables. When it came to looking at local food systems, absolutely, I think this is a really important finding that people are so interested in. That the pandemic has really brought to light the importance of local food, and that looking more closely at how to build up resilient food systems. We found this as well. We found that people were really interested in supporting local vendors and local producers, and wanting a more resilient food system. When it comes to particular vulnerable populations, I would just add that a few things that we saw in our research were that seniors tended to do much better, and other groups like youth and people with disabilities and racialized folks did not do as well when it came to healthy food or running out of food and not having money for more. Personally, I would be interested in hearing more about initiatives that have happened throughout the pandemic, and what you saw or what you suspect was happening in terms of supports that were happening on the ground and from government. I'd also be interested in hearing about mental health and what role mental health might have been playing in how people were accessing food, or the effects of their food access on their mental health. So I know I need to be quick, so I'm just gonna turn to a question for you. You've got these two major findings, one around vulnerable populations, one about the exacerbation of vulnerabilities for people in food access, and then this other finding around resilience and building up local food systems. And I wonder if you could provide any comments or any recommendations around how to bring those two things together, how to bridge those or make some connections between the vulnerabilities of people and allowing them to have more access at a local level, having more access to local food. So I will sort of leave my question there, and I look forward to hearing what you have to say.
Thank you very much, Marianne, for your comments. I will actually just go ahead and pivot that question right out to our panelists. We have a number in the Q&A, but I'll see if one of our panelists would like to just, I guess, respond to the respondent first.
Yeah, maybe I'll start first, and then other people can join in. For one thing that I feel that, you know, when people say that they really want to access local food, and that's something that I feel like, wow, you know, it's just not any food. They just want local food, you know, at this time of crisis, because we trust each other, and you know, it's the sentiment that we trust the local producer, we trust each other, and we want to support people in our local economy. And the thing is, I think the problem is big. It's not just, okay, let's just, you know, increase the land. Let's just have people plant more gardens. It's not just that, right? I think it's a big problem that many people have to come together, because there's so many problems. For example, you know, like I mentioned, in terms of land access, agricultural land has been under pressure a lot. You know, for example, in BC, we have one of the most expensive land in the lower mainland in the country. You know, like our farmers are not going to make it if they have to pay $100,000 an acre, for example. So that's one of the problem. Or some other thing is in terms of food policy, it's related to urban planning as well. You know, like if your community has smaller stores that you can just go, and that will ease the trouble of people who don't have transportation. You know, you can just walk to the stores, right? Because we hear, not related to this project per se, but during the pandemic, we have the farm school, and our farm school donate food to vulnerable families in our communities. And the problem is they want to have those food, but they said it's just not possible for them to come to the farmers market, because, you know, they don't have money to pay for the transit, or whether it takes like 2 hours, and they can't just spend 2 hours back and forth, you know, for example. So these are more like urban planning and food policy. How do you manage making sure that, you know, that there's access to food at different level, right? So I think I'll let other people join in.
I saw Irina unmute, and so I think you have a comment, but also there was 2 questions I think that were specifically directed at Irina in the Q&A. One about Facebook ads and bots, and then a second one about the data set and publishing this type of survey. So I was wondering if you could speak to those as well, since you have the
Thank
floor.
you, Kathy. I actually unmuted myself to say I think Wallapak's got it covered, and thank you for that, Wallapak. I don't know if Marianne is satisfied with that answer, but that was a really great reflection on our work. Thank you for that, Marianne. So yeah, really quick on Facebook. The bots weren't so much the problem as really mean comments. And what I mean by that is I don't even use Facebook. I literally created a Facebook just to post this ad on, because I didn't really want to subject anybody else to what might come. And the kind of conspiracy, COVID is a hoax kind of responses, and accusations of myself working for Bill Gates went rampant. So I think people who were interested in the survey would just follow the link and do the survey, but the comments that were posted on that ad were like astonishing, like several dozen in the first day that the ad went up. And what happened, actually, Facebook shut down my profile that had no other content, I think because it was misinformation about COVID. Eventually they reactivated it, and we're able to get sufficient responses for analysis. But yeah, it was a really weird environment. That was a new experience for me. So bots weren't a problem, but Facebook users seemed to be an interesting bunch in this particular case. And then in terms of disseminating our results, first of all, thank you, Alexander, for the comments about the amazing data set. We're pretty excited about it, with the caveat of understanding all the limitations of this kind of work. We did do media releases in our media departments at our universities, actually worked really closely with us, but we didn't really get a lot of pickup by the media. We're not sure why, but this is one of the ways in which we're trying to disseminate these results through the webinar. We are also developing some academic publications, and Diva is actually about to submit a paper on this pooled quantitative analysis, and we're going to be developing a qualitative reflection on these text answers, but also hopefully with some feedback from this webinar too, is doing some of the more publicly accessible publications, even though you know, we're trying, all of our reports are already available online to everybody, but it's one thing to have it online, it's another thing to drive traffic to that. So we're working on it, and if you have any suggestions, please let us know.
I was wondering if Diva had a follow-up comment, since you were tagged a little bit in Irina's response, and then further there was a question in the Q&A directed at the Quebec component about demographic differences, specifically gender.
Yeah, no, I didn't have time to get into the details of the limitations, but they're very important to acknowledge. I mean, this is not a representative sample of any of the individual provinces or the collection of those who we studied. So really important to think about that and critically assess these findings. But I think what gives us confidence in our observations is that the observations are aligning with results of other studies that have had more rigorous methodologies, ability to weight their samples to create a representative sample. I'm thinking of, there's a recent paper from a Quebec group that studied dietary changes and food insecurity during the pandemic, the first lockdown period. They actually reported that diet quality seemed to increase during that lockdown period. But like I was sort of alluding to, diet is complex and can change very quickly and really go up and down. So while some periods of the pandemic, people may be more mindful about healthy eating, it may go back down and really kind of fluctuate over time. So it's a very complex issue. I mean, the only other comment I wanted to kind of echo into about sort of impacts and responses to the pandemic, I'm really excited about the conversations about universal basic income. I think we can all agree on this webinar that one of the root causes of issues around food access and food security is kind of grounded in income inequalities. And I think that having supports for people are so important. And some of those conversations are really exciting to kind of follow and see where those will go, because I think that will help reduce those inequalities across the population in the future if there are some more efforts directed into that. And I think that people during the pandemic really did rely, people who were vulnerable and had income impacts really did rely on the government supports that were available. So those were certainly invaluable. And that's all from me. And demographic differences, you know, like it's tough with these online surveys. You get who wants to participate, right? That's the crux of it. It's voluntary. And again, in Quebec, I think that there had been so many surveys being conducted online at the same time that there was a lot of competing research projects going on and people losing interest in participating in so many. Thank you.
Thank you, Diva. So we are coming towards the end of the time, but I do want to actually ask Mary if she would take our final minute to have the final word. There was a question in the Q&A about awareness about the outbreaks in meat processing plants, which I thought perhaps you would be best suited to respond to, and maybe any concluding statement.
Well, we did have some comments in the qualitative questions at the end regarding, you know, the concerns about the globalized food system and the interest in local with respect to those outbreaks in the meat processing plants. And it was mainly about concerns about the health and safety of the workers there. But we did note there was a significant decrease in the amount of meat consumed, reported by participants. And it could be linked to that. I mean, we have no way of knowing. It could be linked to the higher price of meat that was noted. But we had a double tsunami hit Alberta. In addition to the pandemic, we had the collapse, or, you know, huge decrease in the oil and gas industry here, which really impacted employment in the province. So as a result, demand for emergency food really increased dramatically in the province. And it wasn't just the food bank that stepped up. We had all sorts of social service agencies working to address the need. And there was a huge influx of funding from the federal government, provincial government, and the municipal here in Edmonton as well. So you can't help think that all of those things contributed to this declining meat consumption. In terms of, it's putting me on the spot to make some final wrap up, but I just want to acknowledge everyone, I guess all the members of the team for all the work on this. I'm especially grateful to Diva for her quantitative expertise, because this isn't not my area. But I think the fact that this was carried out, in 4 provinces across Canada, gives it some real meat. Yeah, it was a great experience working with everyone, and I hope that this, the response to the webinar and also the publications that we hope to get out of it are of value.
Thank you very much, Mary, and apologies for my glitchy internet. I do think we are at the end of the time. I almost feel like we're just getting started in the discussion, so I hate to bring us to a close, but I am very sure that the panelists would welcome you to get in touch with them individually or collectively through FLEdGE or through WALLAPAC or I believe the individual contact information is readily available for any of the panelists if you would like to reach out with further questions. I hope this has given you a real sense of the initial situation analysis, but more importantly, that it gives you insights on potential new research priorities that might come out of this initial and early research in the process of the pandemic, and what your next steps might be, both in terms of research, policy, and practice around food systems and food system relocalization. Amanda has posted a number of resources throughout the chat, so if you'd like to save all those before you head off, thank you very much, and a very big thank you to all of our panelists for the presentation today.